Hi, in this video, I'll be talking about how to manage changes in your appearance during breast cancer and its treatment. When we think about changes in the body and how we look after breast cancer, we tend to focus on the breast, the chest wall area, because we know that people who have breast cancer surgery have an incision. If you have reconstruction, you'll have more incisions. If you use your own tissue, for example, tissue from the abdomen will leave a scar at the lower abdomen, or if you have a flap from your back muscle, it leaves a scar on the back. I'll talk more about that in a moment, but there are other changes. For example, if you have chemotherapy, hair loss is nearly 100% likely to occur at some point during your treatment course. If you're living with advanced breast cancer, metastatic breast cancer, we tend to use treatments where you won't always lose your hair, but at some point hair loss will be part of your experience, for most people anyway. We also know there are other skin changes that can affect the way people look, and there's also changes from radiation therapy to the skin in particular. So I'll go through each of those and give you some tips and try to normalize feelings that you may be having. You know, feeling exposed when you've lost your hair can make people feel really vulnerable, like you're on show or you stand out. And with breast cancer chemotherapy in particular, after quite a few cycles, you can lose your eyebrows and eyelashes. And that is when people feel really distressed, because I've been told things like, I look like an egg, or I look like an alien, and it's really clear that I'm going through something. Tends to make you look more ill than hair loss on your head, because there are things that we can do that are easier. So starting with loss of hair on your scalp, we have another video about this, but this can be extremely distressing. Losing the hair on your head when your hair is, for example, part of your identity, part of how people recognize you, can be really upsetting. And it's expensive to buy a wig that resembles your normal hair. I do recommend and have recommended that you do have some sort of wig so that you're not as exposed. You can decide who knows that you've lost your hair. If you really don't care, and there are people who really don't care, then you don't have to get a wig. A wig is called a cranial prosthesis, and your oncologist can write a prescription. And if they use the word cranial prosthesis, your insurance, if you have insurance, will cover part of the cost of a wig. There are also people who have really fancy wigs who no longer need them, who will donate them to a wig bank. And that can be a way that you can have a really nice wig without having to pay for one. So let's move from wigs to alternatives to wigs. Some are scarves. So you can get a scarf that can look quite pretty or otherwise attractive or striking or dramatic. The American Cancer Society has a program called Look Good, Feel Better, where they have scarves you can order and also tips on how to wear them. And some of my patients have found that a scarf is not just more comfortable, but they actually prefer the way it looks. Another option is just to go without any head covering. And this can be part of you saying, you know, I'm going through something and I don't mind that you notice. I want to normalize hair loss. I've had grandmothers who've had their grandkids use those gel pens for the skin and mark their head up, and it can help the kids feel less alarmed by how you look. But of course, that's up to you and how things work in your family. Hair loss can be really hard for kids if they're at that pre-puberty, early puberty age, like 9, 10, 11, 12. So you may find that while your other kids are okay with you going without a head covering, children in that age who really don't know who they are and they're much more attuned to appearance might not be as comfortable with you going without some sort of head covering. So, you know, see how it goes in your family, but be aware that age group can be particularly sensitive to your hair loss. Loss of the eyebrows and eyelashes can be much more upsetting, and there are ways to cope, whether it's with temporary tattoos, permanent tattoos, eye pencils to keep a brow and eyeliner, false eyelashes. Look Good, Feel Better, which I talked about just a moment ago, has a whole lot of ways that can help you put on makeup so that you look as much like yourself as possible, but don't ever feel pressured to do so. You might feel pressured by people around you, like your parents or your siblings or your kids, to do so. And unless they're in that tender age group, this is your body and it's really your choice how you want to look. But it can help to know that there are alternatives and resources to help you look as much like normal as possible. In terms of surgery on the breast, lymph nodes, reconstruction, getting clothes that make you feel as attractive as possible can be really helpful. There's no reason to hide your body, but you may find yourself with this impulse to cover up parts of your body that make it clear you're going through something. For example, if you're particularly private or at work and you don't want people to know, or in your social circle, you'd rather keep this private. So you may, for example, want to wear a higher neck line so that people can't see that you have a port or that you've had incisions. And at other times, you may just want to look, you may want to feel more comfortable, and you may care less about how you look. This is so personal. I just want to let you know that no matter what you're feeling or what you want, it's okay. This is your body, it's your community, it's your life, and you really shouldn't be working hard to make other people feel comfortable. You're going through something pretty extreme. So taking care of yourself is really a high priority. The other things that can change on your skin are you can get pigmentation of your palms or your soles. You can have changes in the nail beds of your nails. They can get darker, and your tongue can look different, as well as the inside of your mouth. That is normal. It occurs with chemotherapy. Sometimes we forget to tell people, and then it's not even freaking out, it's just being concerned. So I'm hoping that telling you this can help. If that happens to you, know that it's normal and it will go away. It will fade. The discoloration of your nails will fade, and the discoloration of the tongue and the inside of your mouth will fade over time after the end of chemotherapy. Finally, I'd like to talk about changes in weight that happen when we are not sticking to the same routines, whether it's we're tired so we're not moving as much, or people are bringing food over for us. It's very common for people during chemotherapy to put on weight. The stereotype and the sort of image we have from Hollywood is that people will lose weight, and gaining weight can be quite distressing. If you have a history of an eating disorder or disordered eating, I want you to take all of this with a special care in terms of how you hear it. If it's important to you to maintain your weight and not change weight, I recommend staying active and watching your weight really carefully, as long as it doesn't activate problems with your relationship with food from the past or that you're facing right now. If you have a history of disordered eating or an eating disorder, they're not exactly the same. Talk with your medical team. This might be time for you to reconnect with the therapist that you've seen or a nutritionist. Don't feel that you have to hide this. It's so common that your medical team should be aware of problems with eating disorders and your relationship with food during breast cancer and its treatment. If you're living with advanced disease, you're more likely to lose weight, not just because of the treatment, but also because of the disease itself. This is another time to reach out to your medical team and see a nutritionist, because they can help you keep on weight, and your medical team can work with a nutritionist to help keep your appetite up. Loss of appetite can be really distressing if it's long-term, from long-term treatment or from the cancer itself. I've covered a lot. I hope it's been helpful. If it has, click like and subscribe, and feel free to drop us a note in the comments or a question. We try to get back to those as quickly as possible. And if you want to learn more about treatment options For you, you can go to yerbba.com to learn more about the treatment options that might be offered to you. And you can also follow us now on Instagram. Thanks for watching.